So here we've got Russell Workman. He's the Digital Inclusion Advisor at Digital Communities Wales. And he's going to be talking for the next 10 minutes about digital confidence, health and well-being. So over to you, Russell.
Thank you. Thank you very much. My name's Russell, as you say. My role is the Digital Inclusion Advisor for Swansea and Neathport Talbot with Digital Communities Wales. Digital Communities Wales itself is a Welsh Government funded programme which is delivered by the Wales Cooperative Centre. Just see if I can move that on. There we are. There we are. We're a Welsh Government funded programme which is delivered by the Wales Cooperative Centre, and the aim of Digital Communities Wales is to promote digital inclusion and to reduce digital exclusion. So when we talk about digital inclusion and digital exclusion, as has been mentioned already, it's often talking about who would most benefit from this. Now, not everybody, as somebody pointed out earlier, not everybody will want to actually be online, but digital inclusion is about the potential for someone who wants to be online to have that capacity to be online. So sometimes when we talk about digital exclusion, it's often those who would most benefit from access to digital that are in fact most digitally excluded. So older people, disabled people, social housing tenants and the unemployed. The National Survey for Wales, as you can see in the graphic there, said that digitally excluded people are some of the heaviest users of health and social services, so risk being left behind in the digital health revolution. So whether that's ordering prescriptions online or booking medical appointments, having consultations with a GP, paying bills, searching for jobs, applying for jobs, claiming benefits, all of these are increasingly becoming digital activities. The Older People's Commissioner for Wales in the Leave No One Behind report, for example, said that this has been a particular issue for older people who are not online, and the pandemic has highlighted the stark divide in Wales, as well as a significant impact that digital exclusion can have on many people's lives. COVID-19, there we go, it's changing. COVID-19 really has exposed the extent of digital exclusion across Wales and across the UK, with 1.9 million households still lacking access to the internet. Suddenly, individuals and families in lockdown faced huge challenges, and it quickly became clear that the pandemic was leaving these digitally excluded individuals and families isolated and desperate. There were several responses to this. One of them, just to give an illustration, was the Devices.now campaign. And Devices.now was an initiative set up by the Good Things Foundation and Future.now. And it aimed to get thousands of internet connected devices out to people who were further excluded from technology during the coronavirus outbreak because they couldn't access the internet at home, at their local library, at their school, at their college, at their community centre, as they had previously done. So through donations from large organisations such as Lloyds Banking Group, British Telecom or BT, and through crowdfunder contributions, Devices.now was able to help over 10,000 individuals and families across the UK, including people in Swansea, where I'm talking to you from now. The Devices.now initiative has now ended, but it has given birth to Reboot, which is, there we are, which is an interactive platform providing practical steps to enable schools, charities and community groups to set up their own device distribution platform. They provide free guidance to explain how to collect, restore and rehome devices. And this approach makes sense because there's about 1.9 million households, about 11 million people in the UK who are lacking access to the internet, leaving them digitally excluded, struggling to connect with loved ones, with employment opportunities, and particularly with healthcare, as we're talking about today. Yet at the same time, the UK creates the second largest level of electronic waste per capita in the world, with something like 28 million smartphones lying unused in homes and offices. I'm sure that if we look through our kitchen drawers and office drawers at home, there's a smartphone or a phone lying around there somewhere which could be used elsewhere. Another initiative started right at the beginning of lockdown called Hubbub, and that worked with local community groups in Southwark up in London to promote a smartphone donation scheme. The public donated old phones, which Hubbub cleaned, data wiped and successfully redistributed to about 500 vulnerable households. Subsequently, that project was taken to 2 more London boroughs, then Manchester, then Leeds, and the aim is soon to launch in Bristol, Glasgow, and in South Wales as well imminently. So watch this space. And that delivery model has seen the redistribution of some 3,000 smartphones already. So what about in Wales? Well, the response to COVID within Wales has been interesting. The Welsh Government in April announced £800,000 worth of funding to supply care homes and hospices with digital devices. There followed a similar provision for sheltered housing and more recently communities for work to help them support people getting back into work. Digital Communities Wales offered also training to organisations such as care homes all across Wales so staff could confidently help their residents or their service users access tablet devices. One of the things we did was provide training on the Attend Anywhere NHS consultation service. And that's a vital factor. There's little point giving someone a device or connect it to the internet if you don't also give them the skills to be able to access the online world confidently, but also safely, because the number of scams and this type of thing, but it's about doing things safely. So it's about devices and data and training. All three are essential. Digital Communities Wales also has kit loan, and our kit loan and training has enabled services to add another dimension to the delivery, or in some cases to continue to deliver their service. For example, the National Exercise Referral Scheme in East Port Talbot has been able to provide online exercise sessions for people who are at risk or who are currently experiencing a long-term or chronic health condition. The Work Development Service in Swansea used Loan Kit from DCW to keep in contact and provide support to their service users. And in hospitals, staff have commented that digital devices have helped the experience of loved ones by able to meet with professionals via video link rather than simply hearing voices during a telephone call. Families able to join therapy sessions, observe progress, and learn subsequently how to care for their loved ones at home. And of course, during lockdown, just to have that contact face to face, be able to see someone when they are socially distanced. One of the things that is a key consideration, and it's come starkly into focus during the pandemic, is the subject of data poverty, which we touched on earlier in some of the comments. And that can be defined as someone who has a device but is not able to do essential tasks because they cannot afford the internet. The reality of data poverty for some families, it really is the decision about whether to buy data or to buy food. And data poverty can involve these three factors: the affordability of connectivity, whether how you buy it, and you know, whether you do pay as you go, can you afford broadband. There's exclusion from accessing basic digital services. There are very few websites that are available without the user incurring data charges, and that even includes government services. And then also the systemic issues in securing access. You know, people with insecure employment or credit checks, for example, and that can lead to problems in securing telephone contracts, resulting in the fact that they have to choose a pay-as-you-go option, and they potentially then pay a poverty premium. All these things can be barriers. So COVID-19 has demonstrated that access to the internet is now more important than ever, and to take advantage of and to participate in today's digital society and economy. How do we address that exclusion caused by poor connectivity, lack of devices? Well, the Future.Now campaign identified 3 key things that could be done. Data pooling, data gifting. It's the pooling of any unused bandwidth to provide connectivity options to those who can't afford it. Zero rating tags, Sorry, some of these things are taking a little while to come up. Zero rating of sites when an internet service provider removes data usage fees, effectively applying a zero price tag on an internet service, so that any data traffic associated with a particular site doesn't count towards any data cap. And there's been several of these during lockdown. Some network providers have waived data charges for websites such as Citizen Advice or the Money Advice Service or Mind the Mental Health Charity. And back in January, you may remember, particularly if you've got children, that BT and the BBC announced plans to zero rate the BBC bite-sized learning platform for all EE, BT and PlusNet mobile customers when the schools remain closed. Opening up local Wi-Fi and connecting it is a third way of addressing this data poverty, and that could be working with local authorities and communities to access freely available connectivity, free public Wi-Fi and free neighbourhood Wi-Fi as well.
Just a couple of minutes, Russell.
That's okay. I'm just coming on to my last slide. Here we go. So you may have seen last week the Digital Inclusion Alliance for Wales announced its digital inclusion agenda, from inclusion to resilience, setting out what it believes are the 5 approaches that are essential to making Wales an exemplar for digital inclusion. The Digital Inclusion Alliance for Wales is a network of individuals and organisations committed to joint action to significantly shift the digital inclusion agenda in Wales. And these are the 5 priority areas that they feel should be for everyone, so that they can access and benefit from internet and digital technology. COVID-19 has really pushed the envelope in terms of digital engagement, and we are seeing more and more the services and information going online and becoming, in some cases, possibly in many cases, only available online. But possibly this pandemic has also demonstrated, even to some of the most reluctant, that there are benefits of being digitally included. The first speaker mentioned the fact that sometimes people have been asked to go online and just to deliver your services digitally and just get on with it. If you're in Wales, Digital Communities Wales is able to help you. As I said, we're a Welsh Government funded programme. We've got a range of free training opportunities that you can access, and they can be bespoke for you. And we are able, if you want us, to come and do a conversation with you about how we can best support you to provide the services, to upskill your staff, your volunteers, even working with carers, to provide digital services, support the poorest members of society, the people who need it, to access digital. My details there. I've whizzed through that. It was trying to a lot of information. I wanted to try and get through, particularly like what was the conversations earlier. But that's me. That's my address. I'm happy to have a chat to anybody if anyone wants a conversation. And yeah, I hope if anybody's got questions, happy to help after.